So, if you I've got too many slides for the time, so I will rush over some of the early ones, but they're available too if you want them. If you think about the systems we're working in, we have to move with the times. In the 19th century, they were building the system. In the 20th century, they were worried about public health and safety and about education and training. Specialisation across the disciplines happened, and then we went into managerialism at the end of that century, and managerialism seems to be something that is totally entrenched. But in the 21st century, the title of my presentation is that clinical people, clinicians are in ascendancy. Managers are starting to realise the importance of talent as well as just managing the bits and pieces that move around the talent. So the talent, I'm talking about the clinicians. The person-centred care movement actually started focusing on what clinicians can do. Consumer-directed care is coming in now. Health literacy is rampant with the internet. Nobody goes to see a clinician without looking up what you've got and finding out what Google says about it. So, I mean, and you need to know more than they do. So you need to have Googled first. And then, of course, clinical proficiency is the buzzword, and clinical leadership, and I saw clinical governance there. So this is the world we're living in right now, and you're right at the forefront of it. But we're talking about the health reforms, and it's much touted, but what I've done is I've actually put down here the area of health reform under which I was appointed to the National Lead Clinicians Group. These are the sorts of things that have come in. They're starting to feel like old news now. We're getting quite used to these terms and this terminology. Some of the reforms actually have performance indicators for ED and for primary healthcare services and Medicare locals, and that's what we're working towards. So when we say healthcare reforms, this is what we're actually talking about. These are goals that we have to perform against. So the part where I come in on the National Lead Clinicians Group was that commitment to enhancing clinical leadership. And that's why I say clinicians are in ascendancy. We're actually getting a voice in this whole huge system, and people are listening to us. We were asked by the Minister to provide that sort of leadership and advice and expertise on national clinical issues. So just quickly I'll run you through. That's the Rogues Gallery, me in the awful jacket. And that's the clinicians as well as some of the observers. So when you actually look at the money that's been spent on that, it includes our relationship with the Australian Medicare Local Alliance. And we regard that as one of the key relationships between the National Lead Clinician Group and the AMLA. So when you are thinking about your network and who you can use to move things around, I mean, this conference is movers and shakers. If you're thinking about some of your alliances that you can make, don't forget the National Lead Clinicians Group. These are the people on it. For the nurses in the room, there are 2 nurses, 1 nurse practitioner and moi. So if there is any issue that you want to bring forward, I will give you the email at the end. Please don't hesitate. If you have an issue that you want raised at that National Lead Clinicians Group or through the various working groups, I'm quite happy to do that. These are the ex officio attendees. So they actually sit there. So we've got the Commonwealth Chief Medical Officer and the Chief Nursing Officer. We've got NHMRC, the RMAC, and the Commission on Safety and Quality in Health. So these people, we can actually ask them to do work and bring us information. So it's a very good opportunity for everybody. So I want you to use us, okay? So in this year, we've been looking at spreading clinical practice nationally. We're trying to look at the outcomes of care. We're also looking at integrating best practice. We're looking at promoting best practice. So we're looking at clinical guidelines, and we're looking at transitions of care, people moving from one sector to another and across disciplines, and how that handover occurs. But enough about that. There's a forum coming up, and it's free, and it's happening in June, and it's in Sydney. And if you get onto that website, you can register for that. And for people who live out not Melbourne, but I mean out in places where travel is difficult, although after this morning. there are scholarships and they can help you with transport and some accommodation. So please, if you want to be part of that, come along. We've got 500 spots available and they're filling up fast. It only opened last week, so get in if you want to come. When we talk about nursing in Ascendency, and I want to talk to the nurses in the room particularly right now, you have to be sure about what you are, what you do, who you are as a nurse. And I mean, I know that sounds silly, but nurses are so diverse and we're so clever that we can be sidelined and diverted into all sorts of things and we make it work. That's what we do. But it's very easy from your point of view to get lost in all that. So if I did some research in 2011 and basically that is the definition of nursing, the application of contemporary knowledge and skills to help people to respond in healthy ways to situations they are either in or are facing. And we manage the environments in which that occurs to maximise the benefits for patients. Right? Now this applies to you as well. Now when you start getting involved in all kinds of management, quite often you have to ask yourself, is this management for nursing and nursing processes, etc., or is it management for profits or something else, not quite health? So ask yourself whether you're actually still doing nursing or not when you're actually taking on a job. Once you've got that, you have to think about, okay, how am I going to make this work for me? How am I going to get my voice heard in the hubbub? And there's a hubbub out there from doctors, from allied health people, from consumers, from politicians, from government, from local government, from hospitals. How do you get your voice heard? Some of the things that you need to ask yourself is how much control you have over your work. How much autonomy do you have about nursing processes? Are you individually accountable for your nursing? Or is it just lost in the interdisciplinary mix? And quite often it can be. Are you as a nurse able to focus on your client's well-being, which may actually be in tension with what the organisation wants you to do? And this often happens in hospitals and EDs, where they have performance indicators of churning people through. But you think this one needs more time, this one needs something different. Are nurses prepared to be role models for other nurses? Do we look after each other? Or are we just doing the job and just saving up for the new driveway, which may be a good thing. The other thing too is that most of us have no redundancy in our day. We pack our day from the minute we start work right through and then a bit. So making time to actually pursue your own personal development is sometimes quite difficult, and you would have to probably do it in your own time if you're going to do it, because there's just no time at the job. Will you actually commit time and money to support your own profession through memberships, publications, research, public meetings? And the earlier presentation, clearly they're very interested in doing that, so that was most encouraging. If you think about your influence, there's a very old typology of social power in organisations, and French and Raven, and I still think this is a good way to think about where does your power base lie. Is it because you've associated with a powerful group? And practice nurses have associated with doctors. So that's a powerful group and they know how to do it. I have actually watched with amazement how medicine can actually move resources and influence policy, etc. So referent power you certainly have. Expert power, which means that you have individual knowledge and skill that other people don't necessarily have. With nursing and medicine, there is a huge overlap area. Doctors have a very specialised area, nurses have a specialised area, but there's a huge overlap of shared knowledge and skill. You need to be aware of that and where you are on that pattern. The legitimate power means that you have positional authority. You have the authority because it says you are the manager or you are the CEO or whatever, and that position has the power. Other more informal sorts of power could be reward power. That means that if somebody works for you, you can actually get them a better office, or you can get them a better computer, or a chair that doesn't fall over when you sit on it. Coercive power means that you can make things uncomfortable if things aren't going your way. Okay, and we've all met these people who use these power bases. You need to analyse your own situation and figure out Where are yours? And if you've got about 3 of them, you're doing quite well. Yeah. I'd rather you didn't go to the last one. Just a personal thing. Okay. Now, how are you going to know if it works? Your success indicators. If you can actually move resources around or allocate resources to different places, if you can control information, like you can decide what information do we need to collect here and what are we going to do with it? Who needs to see this? If you can get some influence or control over decision processes, like getting things onto the agenda of a committee that decides on resourcing, that's powerful. And your own personal experience often is where nurses come in and they are well respected simply because they have this wealth of experience, this broad experience, and just about anything that comes up, they've either experienced it or know somebody who has or read about it or done something about it, and they can contribute. Now, the things that influence what you can do with this, of course, are the way your job is structured and the way your role is designed. If there are lots of rules around what you do, then you don't have a lot of power. If you are expected to follow routines, routines are built to control idiots, right? They're idiot-proof because a manager can check on a routine at a particular type of day and see, well, if this is 11 o'clock, these things should have been done. Okay, if you're working to routines, then you don't have as much power and influence in your job. Rewards. Are you actually rewarded in terms of your salary? Do they make you wear a dumb uniform? Do they make you wear a really ugly uniform? The same as everyone else, including the cleaner. Can you set a precedent? Can you actually trailblaze on something? Can you actually say, look, okay, I know that's the way we've been doing this, but we're going to do it this way, and we're going to evaluate it. And as soon as we evaluate it and it works out fine, that's going to be the way we're going to do it from here on. Can you do that in your job? Is there variety in your job, or is it just endless drudgery? Can you introduce variety in it? Can you control the timing and the flexibility of your job? These sorts of things give you job satisfaction and gives you some sense of success in what you're doing. So some of the things, if you want to build a professional power base, you want to really ascend up there, be flexible. Nothing's a problem. Yes, it goes outside the routine, but you can do this. Be a can-do person. Resist routine. Unify. Don't divide and conquer in the organisation. Talk to people. Negotiate. Make autonomous decisions. As professional nurses, you are expected to make autonomous decisions. Somebody objects, you have reasons as to why you made that decision, and you have a professional discussion about that. Control your own information. Do you actually log what you do as a clinical nurse? Do you know how many patients you've seen? What was wrong with them? Did you track them? Was it a successful intervention? Did you evaluate it? And you need to have that information on your own practice, as well as make sure that people who need to know that know that. Strategic contingency skills. That simply means problem solving. That means if something comes up, can you deal with it? You should be able to. You should be able to be innovative if something comes up. You need to be good at negotiation, persuasion, and you need to be accommodating. Other people have problems, other people have pressures. You can accommodate them so long as they're willing to accommodate you when you have pressures and time frames that are pushing you. Don't procedurise what you do. Nurses, I don't know why, I think it started in the 1930s, but we started writing procedure manuals. And nobody ever signs them. Nobody ever admits that they did this. But you know, they're reviewed and updated, and you know, people, oh, is that the procedure? Yeah, well, that's the procedure we're using. And try not to substitute yourselves with care staff. That's what's happened in aged care, and that's what's happened in a lot of places in the community, where quite skilled professionals, psychologists, nurses, allied health professionals, have been substituted by care staff who know the task, but they don't know the reasoning for it or the theory. So, capacity building, you've got to ask yourself some questions. Are patients aware of what you as a nurse do for them, or do they just come in and just have a general interdisciplinary experience? Are patients actually getting access to nurses in the way you set up the thing? Or are nurses just a sort of a tag-on, bolt-on afterwards kind of thought? Do nursing interventions actually, and I was very interested in the earlier statement about looking at cost and health benefits of actually including nurses in the mix. That is a really important question that you need to be asking yourself. So when you're actually looking for the way forward and the opportunities and challenges that came up before, that's very true. These are the things I know about, and I'm not a practice nurse. So I know that they are talking about practice nurses doing medical services coordination, case management in aged care and disability services, especially with the NDIS coming in. Medical home business model is actually being touted here and there that nurses will run. Agency nurses into residential homes who can't find nurses. Electronic medical records maintenance. Okay, now you've got to ask yourself, is this going to contribute to your professional development, or is it just stuff, management stuff? Is it going to help you develop your career pathway? Will you gain access to practice development support? Will this provide opportunities for you to become equal partners in the practice at some stage? So when you're looking at proposed changes, it has to satisfy three things. It's got to be legal. They can't ask you to be doing things that are not legal. Okay, and the people asking you have got to have the authority to do so. Is it feasible? Is it so resource intensive that nobody's going to be able to, it's unsustainable? Or is it beyond your skill that you can't do this? And the last thing is that any proposal has got to have the support of the people who are going to be most affected by it. So the people in your world would probably be the patients and yourselves who are going to be affected most by this. So if you go through those three things on any proposed policy or any proposed change, it should do this. So the key message to finish off with is be aware of the world you're in. What is the legislation around your practice and the limits that it places on your practice? And don't just know the name of the Act. Get the Act and read it. It's all online. Be informed about the political agendas that are impacting or potentially impacting on you. Talk about these things in the tea room, in conferences like this. Ring up people and have a discussion about these things. Identify exactly what policy or proposal is causing you a problem, and before you go any further, work out what needs to change in order for that problem to go away. Then you engage with it. Gather support from your colleagues and get onto forums and take a stand on issues. So thank you very, very much.